Hello, and welcome to the Oprah Winfrey Show. Thank you. Thank you. Pump it up. Pump it up. Today we are discussing a very real and important medical disorder. Something that most men are too embarrassed to discuss in public. We are hoping that by bringing this information to the public eye, that some of the stigmatization surrounding the disorder will come to an end. The topic of consideration today is erectile dysfunction. To help with the discussion today, we have a very special guest here to join us, someone dear to my heart, and someone who also has personal experience with erectile dysfunction. Our special guest is Larry King.
Thank you. Thank you. You all are too much. But keep going.
Welcome, Larry King. Glad you could be here today to join us.
Thank you, Oprah. I am glad that I can be here today as well.
Now, Larry, let's just jump right into it. Tell me about your medical condition, erectile dysfunction. When were you diagnosed and how were you diagnosed with this terrifying disorder?
Well, Oprah, it actually isn't too terrifying or scary. In fact, it hasn't really impeded my life with the ladies. If you know what I mean.
That is a little disgusting.
Anyways, as you may or may not know, I am diabetic, have high blood pressure, and am entering my late 70s.
Wow. I never knew you were that old.
I first noticed there was a problem in the bedroom. I noticed that I was having a problem maintaining and obtaining an erection.
Larry, I noticed that you mentioned the fact that you are diabetic with high blood pressure. Does that really have anything to do with having erectile dysfunction?
Yes, Oprah, it does. When meeting with my physician assistant, she mentioned to me that the most common population of men to develop erectile dysfunction are those who have reached the age milestone of 60, and those who have medical comorbidities such as arteriogenic disorders, vascular disorders or diabetes, and those on certain medications.
So, Larry, I am going to get a little personal here.
That's why I'm here. To get a little personal.
Okay. Well, that's not creepy. You mentioned that certain medications can cause erectile dysfunction. Could you please mention some of the common ones that some of our viewers may be familiar with?
For sure. The most common class of offending agents are those that treat high blood pressure. Some of the other common drug classes are antidepressants, beta blockers, and diuretics. But don't forget, Oprah, medication-induced or medication exacerbation is not the only cause for erectile dysfunction. Other reasons for erectile dysfunction are psychogenic causes, where the hypothalamus of the brain doesn't relay the message to produce or inhibit the penile response, endocrine causes where there is decreased testosterone which inhibits libido, or arteriogenic causes such as atherosclerosis which decreases blood flow to the penis. Therefore, as you can see, erectile dysfunction is a multifaceted disorder that is actually more complex than just not being able to get it up.
Oh, Larry, you are too funny. I am glad to see that you have a sense of humor regarding this diagnosis. Last. Larry, if you don't mind, can we discuss how the diagnosis is confirmed and how it is treated?
Sure. I went to my physician assistant and let her know my problems in the, bedroom. She then told me about a simple test for measuring if it really is true erectile dysfunction or if it is a loss of my libido. My PA wanted me to go home and try the nocturnal penile tumescence test. This test measures a man's erectile function while he's sleeping. Normally, a man will have 5 or 6 erections while asleep. A lack of these erections may indicate there is a problem with nerve function or circulation to the penis. The test uses 2 methods, the snap gauge method and the strain gauge method. The snap gauge method is performed by wrapping 3 plastic bands of varying strength around the penis. Erectile function is then measured based on which of the 3 bands breaks. The strain gauge method works by placing elastic bands around the tip and base of the penis. If the penis becomes erect during the night, the bands stretch, measuring the changes in penile circumference.
Sounds like a pretty complicated testing procedure.
No, Oprah, actually it is a pretty easy process. I just went to sleep and let Little King do all the work. Well, he was supposed to do the work, but fell asleep on the job, if you know what I mean. Anyways, after my test, my physician assistant first prescribed me some medication to control my diabetes, as this could be a primary cause for my erectile dysfunction. After my blood sugars were controlled to a normal level and my erectile dysfunction still persisted, she then prescribed me a 5-PDE inhibitor, otherwise known as sildenafil or Viagra. This medication helps to increase the blood flow to my penis, which will ultimately help me to obtain and maintain an erection.
Fascinating. Are there any serious side effects to taking these medications?
Of course. With any medication, there is always a chance for side effects. Since the medication is increasing blood flow to my penis, it is also causing relaxation of the blood vessels to other parts of my body, such as my heart, lungs, and eyes. Common side effects are headache, dizziness, low blood pressure, difficulty discriminating between the colors blue and green, and double vision or vision loss.
Wow. Thank you, Larry, for taking the time to share your knowledge about erectile dysfunction with the rest of us. Hopefully we have decreased a little of the stigmatization involved with this diagnosis. And I hope that you have learned all you need to know about erectile dysfunction and more through the experiences of Larry King. It is our hopes that if you may be suffering from some of the same symptoms, that you will now feel confident and safe enough to go speak to your physician assistant. Also, please don't forget to join my book club and go to www.oprah.com to find out what Oprah's favorites are. Thank you, Larry King, for joining us today.
Thank you. And don't forget to have your pets spayed or neutered. Ha 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 ha. Wait. Wrong show. Isn't that The Price is Right?
Okay. Till next time, everyone. Bye-bye.